Welcome friends to another chapter of communication. So we need to understand audio video counseling forms a very important part of our day-to-day communication, at least in a corporate hospital. And whenever a patient is very sick or aggressively deteriorating and requires multiple consultations, and he or she has got a very high Apache score with a high mortality rate, in that scenario we need a audio video counseling to prognosticate the family, to tell that we are teaming together for betterment of the patient, as well as make them aware of what are our expectations, what should be their expectations as well. So today I am going to speak about participants of audio video counseling. So from patient side, patient's direct relative should be there, at least spouse or son and children, son, daughter, or their parents. They need to be present in the audio video counseling. Ideal number should be between 3 to 5, lesser the better, but usually in audio video counseling we encourage most of the family members to present so that they can all talk together in unison. Coming to our side, medical side, it should be consisting of few major personality. Number one is the primary consultant treating patient. Number two, ICU doctor in charge who is treating the patient. Number three, one of the nursing senior nursing team or nursing in charge of the ICU where the patient is there, and another is somebody from the administration team, so that they should be taking care of other finer aspects like visiting hours, day-to-day affairs of billing, fooding, and as well as security clearance. So all this should be answered by the admin team as well. And we always encourage our medical superintendent to be present to make sure to avoid any sort of medical legal problems if it comes any forth, because most of the times during this audio video counseling, finances creeps in, the discussion about finances creeps in. So in that scenario we'll need a medical superintendent to intervene in it, and the discussion should be such that it should be in a unison, and that should be eye to eye contact, and people should be sitting in front of each other. So what we do in our audio video counseling, there's a table over there, we sit in one side we sit as a medical team, and the other side patient attenders sit together. And most important part of the discussion, as I have already told you in previous shoots, that listening should be a major part. First, listen to their pleas, their problem, and what are their expectations. Then you can break even and start telling them, this is our plan, this is going to be a plan for coming 24 hours, 48 hours, or in the long run, or so many teams have been involved over here, and make sure that a medical superintendent or admin team also supports your decision in that respect. And there should be adequate eye to eye contact, there should be adequate listening time, and mobile should be switched off, and at a specific time of half an hour to 1 hour should be earmarked for this process, because if there's any give and take, there's any problem in this discussion, the relations become sour, and when relations become sour, the trust breaks down. So to keep up the trust, to develop that symphony between treatment as well as the counseling, we should have a adequate audio video counseling of around 10 minutes to 1 hour in presence of all this personality. So make sure that audio video counseling is successful if you take care of all these things. Thank you so much.